All right, so we're doing GI part 2. So these, last time we did the tubes, and this time we're doing the rocks. So we're doing the organs of the GI system. What are the organs of the GI system? So we're doing the liver, okay? What else? The gallbladder, which hides behind the liver, right? And what else? And the pancreas, okay? And all those come in together and they empty into the duodenum, right? The liver makes bile, stores right there in the gallbladder, and then it makes its way down into the duodenum. It's a little bit delayed. Anyways, so we're doing the rocks. All right, so the biggest organ that has the most functions is which one of those three? The liver, right? How many functions does it have? More than 500 functions. All right, so it does a lot of things, so it has a lot of complications, there's a lot of symptoms. The treatments are really for the complications, right? You obviously want to prevent those things from deteriorating in the first place, so we'll talk about that. But we're going to be focusing a lot on liver. All right, so one of the things we'll talk about first is hepatitis, all right? Because your liver fails, it usually becomes what's called cirrhotic. And cirrhotic means sclerosed or scarred, and it gets small and shriveled, and it gets cirrhotic, right? So there can be different things. Right now I'm recording from my laptop to the computer. Last time I was recording from the computer to laptop, so it's a little bit, I'm not sure which one I like better, but either way, cirrhosis is usually the end point of damage to the liver, chronic damage and chronic inflammation. And what happens with chronic inflammation that we learned about last week? You get cancer. So sure enough, if you get cirrhosis, you're at risk for cancer as well. Okay, so that's one of the end results that can happen is cancer. But before that, you're going to get cirrhotic. You might get a little fibrosis, which is just the groundwork for cirrhosis. But healthy liver can become what's called fatty, and it gets fatty because of a few reasons. It's fatty because you have alcohol. Alcohol gets converted into fats, and then it finds its way somewhere in the body to deposit, and it usually deposits on organs, visceral organs, and it can deposit on the liver. And is fat inflammatory? Yes. Obesity is a significant risk for all cancers, right? So it's also a risk for chronic inflammation. More and more inflammation leads to cirrhosis, scar tissue, and then can lead to cancer. Okay, so you can skip the fatty step and you can just get cirrhosis directly from long-standing inflammation, and that's one of those things is hepatitis. So hepatitis can cause is a inflammation-itis of the liver. Is it even there? I just made a mark. Maybe I can't see it. Okay. Anyways, hepatitis is a inflammation of the liver. And most commonly, it's alcohol is pretty common. Overdosing on drugs can be a reason why your liver gets inflamed, or we can have different viruses that attack it, A, B, C, D, sometimes E, but really we focus on A, B, and C. Really, as far as like hepatitis, viral hepatitis, there's so many out there. But when we talk about hepatitis virus, that is, we're focusing on the hepatitis A, B, and C. Okay, but there's other reasons for your liver to get inflamed. All right, such as these. So inflammation of the liver due to infection. So that's what we talked about viruses. All right, so we have A, B, C, D, and E. Okay, and most common, it's actually first place. Second place is alcohol. Sorry, where are we at? So second place is actually drug overdose. And then we get to alcohol and other causes, all right? But we'll spend some time with viral hepatitis or hepatitis on the next couple slides, okay? But you can have bacterial infection, you can have protozoal infections, you can have amoebas attack your liver, right? You're drinking fresh water as a traveler, right? You don't, it's like a still pond. That's not a good idea. So there's amoeba that can live in there, there's all kinds of nasty stuff that can live out there. But most commonly, it'd be viral, right? And we'll talk about how you get the viral infection. And then there's also non-infectious sources, such as toxins in the environment, like industrial chemicals, working with like vinyls and plastics and heating those up. That's never a good idea. Like whenever you heat up your leftovers of styrofoam, you feel like you're ingesting some toxins. You are. So that's not a good idea. Not that that's maybe linked to liver cancer, but it's linked to some kind of cancer. Anyways, aflatoxin is very, very highly linked to liver cancer, liver damage, inflammation and then cancer itself, right? But aflatoxins we'll talk about coming up when we talk about liver cancer. It's usually with stored grains and humidification, like eating old grains. It's a mold that's grown on like old corn and mills or the like. Okay, carbon tetrachloride, I had to look up. That's found in old fire extinguishers, and it's usually not used as much anymore. But that's something that's can be if used as an industrial chemical. Shrooms, so you're doing not just like shrooms like fun shrooms, but mushrooms that are out in the wild. All right, those guys can damage your liver and cause you to get inflamed, and it can even lead to death, of course. All right, alcohol, that's pretty common. Alcohol is a toxin. All right, that's your liver can only digest so much alcohol per minute or per hour. And once you go over a certain amount of grams, it's going to start to build up, right? And that's with the drunk feeling. But eventually that builds up way too much, it can start causing damage to your liver. Okay? And then medications, all right? So medications, the second place is causing hepatitis. Most common medication is Tylenol. So Tylenol overdoses especially, meaning that you took too much Tylenol, right? And you could do it incidentally or intentionally. So intentionally, obviously, is a suicide situation, but unintentionally would be they took too much Tylenol. So how would you know if they took too much Tylenol? How much Tylenol did they take? They took more than 4 grams, right? So no 4G. I got this from a conspiracy website for the height of COVID, all right? So no 4G or 5G, but 4G, so 4 grams. No more than 4 grams of Tylenol, no more than 4 grams of aspirin. We'll learn for the next exam about NSAIDs and ibuprofen and such. But for this, if there's too much of a medication or even medication in general can be liver toxic. Okay, so here's some other examples. Ecstasy is not a medication we prescribe, but that can cause damage to the liver. And aspirin, of course, can be damage to the liver, causes metabolic acidosis and damage in of its own right, but it also damages the liver itself, right? And then chemotherapy. So we learn about chemo. Is that the next? I think it's the next exam, right? But we'll learn about methotrexate. Methotrexate is used for autoimmune conditions, but also used for cancers, and it's liver toxic. Bactrim, next exam as well. That's an antibiotic, and that could be used to that could be damaging to the liver. Okay, azathioprine is also a chemotherapy drug. And then we have anti-seizure medications. Valproic acid, phenytoin are liver damaging. Antibiotics, again, next exam, so try not to put too much in your brain, but just so you can, for the final, you got to circle back and say, well, shoot, that was liver toxic, all right? So tetracyclines, fluoroquinolones. Fluoroquinolones are your Levaquin is a fluoroquinolone, levofloxacin. What else? We got nitrofurantoin for UTIs. Linezolid, Augmentin is a combo drug. So these drugs are, and also your TB drugs usually are going to be toxic to the liver in some fashion. Okay. What else? So genetic issues, alpha-1 antitrypsin, you heard that in NS103 in Med-Surg 1. What was that all about? COPD. So it also damaged the liver too. So those are the high risk for liver disease as well. Wilson's is just too much copper. It's something genetic, all right? You have too much copper, and they usually have like a copper ring in their eyeball, and that's how you tell they're high risk for liver disease. Autoimmune situations, there's a lot of autoimmune diseases out there, so we're not going to get anything specific because we're not going to cover them in other units. But other diet issues, so someone eating too many fats, saturated fats especially, that causes steatohepatitis. Steato means what? Means fat, all right? So steatorrhea is fatty diarrhea. Steatohepatitis is a fatty liver that's inflamed. And we have 2 other names for it, NASH and NAFLD. That's just a fatty liver. We have 1 slide dedicated to this coming up. All right, so non-alcoholic steatohepatitis. So remember, alcohol gets converted to fats and it goes around the liver and causes liver inflammation. Well, same thing if you eat too many fats, that's going to get to the liver and cause non-alcoholic fatty liver or steatohepatitis. All right, so this can be chronic and it can develop into cirrhosis, all right, if they have chronic exposure to these things. As we'll find out with your viruses, some of them will have a chronic state and other ones won't. So when you're learning your hepatitis or hepatitis, I don't know a good way to say it, hepatitis, these guys need to be distinguished as acute disease, virus damage or just that could cause can cause death, or it could cause cirrhosis, develop into cirrhosis. They can have a chronic form. Okay, so what else? So you have non-infectious and infectious sources, right? I don't like how delayed it is, but anyways, you have bacteria, fungi, but viral it being your most common, A, B, C, D, and E. Okay, and come to find out that Epstein-Barr virus is everywhere. All right, Epstein-Barr virus, that's herpes, that's a mononucleosis in teens. It just makes them sleepy and fatigued. But in older adults, it can cause all kinds of damage to almost every organ system. It causes multiple sclerosis. It causes all kinds of problems and autoimmune problems. Like we get the infection, but we never really get rid of it. Right? Herpes is the disease that keeps on giving. Right? It keeps getting spread to everybody else, and it can cause a lot of untoward effects. Okay, we mentioned a bunch of drugs. Right? Wilson's disease we're not going to focus on. We'll focus on steatohepatitis, which is NASH, right? And that's our fatty liver right there. See how fatty and juicy it is? Looks like a good steak, but it's not a good liver. All right. What else? So these are hepatitis in the traveler. You could get all kinds of infections and protozoas and fancy things. Like if you drink fresh water, you could get ascariasis, which is worms that invade your biliary tree and your liver and cause inflammation, which is never fun. All right, there's our aflatoxin down there. All right, so other common reasons for getting a hepatitis. And on the left here, we have different agents, which we've kind of summarized up top. But these are different things that cause liver damage. Okay, and we monitor if someone got liver damage. We can look at what's called the AST and ALT. Those are your liver enzymes. Right, and we have a slide dedicated to liver enzymes and what those mean, and which one should be elevated, which one should be elevated, or which one should be elevated more. Okay, any questions on hepatitis and inflammation? We're going to dive deeper into viral hepatitis. Okay, so viral hepatitis, what's going on? It's a worldwide disease. It's everywhere. All right, and it's due to individual behavior. So you can avoid it if you don't get it, if you avoid it. Well, that's a good sentence. Anyways, you have ways to prevent it, right? You don't just get it because you're in the wrong place at the wrong time. Well, you can get it if you're in the wrong place at the wrong time. If you're using analingual sex, that's the wrong place at the wrong time, right? Because you can obtain it via fecal oral, right? You can obtain it via IV drug use. You can obtain it via not washing your hands. You can obtain it by eating something that's been contaminated by someone that's been infected. That always can't be your fault because you go to Panda Express, you expect to have some chow mein, but then you get some chow hepatitis, right? So transmission, right? It's individual exposure. So it could be fecal oral, and it's A and E are fecal oral. That's the vowels affect the bowels is the way to remember that. So A and E are vowels, right? B, C, and D are not vowels. So there's a grammar lesson for the day. We had one last week, right? So A and E, those are your vowels, so they affect the bowels, right? So they're fecal oral transmission. Okay, and then you get it by blood as well. So Hep B and Hep C are by the blood, all right? So B and C, and also secretions from people. So B, C, and D, or B, D, and C, you could say. B and D is blood. All right. When you talk about hepatitis B, hepatitis D, for instance, you can only get it if you have hepatitis B. Hepatitis D does not exist on its own. You have to have acquired hepatitis B for D to take effect. That's why we kind of include it there. But anyways, B and C, that's for B for blood and C for secretions. It's the best I could do, mnemonic-wise, right? And then that doesn't mean that hepatitis B is not also secretions. Hepatitis B is the most common hepatitis, and or the most common bloodborne, I should say, bloodborne and secretion-related hepatitis. Okay, so you have some contaminated food, you have contaminated hands. That's how you're gonna get which one? With fecal oral. That's how you get A and E, right? And E is not as common in the U.S., so really we're gonna focus on hepatitis A, right? So liver cells are invaded by this virus. So this virus makes its way into the liver somehow, whether it went by the fecal oral route, right, which means oral, right? So it went by the oral route, and then it went to the liver. And when it got to the liver, it's going to produce and produce and produce. And which one is fecal oral? A and E affect the bowels, right? So A and E makes its way into the liver cell, right, via the GI tract, goes way into the liver cells here, right? and it proliferates and proliferates and proliferates. Some of it will get into the bloodstream, but a lot of it will make its way down back into the GI tract because it likes to live, right? It likes to procreate. And how does it continue its existence? It's going to make its way down to the fecal oral route again, right? So we're going to go back to square one. Now someone else got infected because someone didn't wash their hands, someone participated in certain sexual practices. There's all kinds of ways to get fecal oral contamination, right? Contaminated food as well. Okay, that makes sense for hepatitis A. Hepatitis B is going to get into your bloodstream usually, right? It's not fecal oral. It usually gets into a cut. So that's why we wear what? To avoid secretions from getting into our open skin. We wear gloves, right? Washing your hands is good, but if you have all cracked hands, you have nurse hands, it's going to get into those breaks in your tissue, and it can get into your bloodstream. So it gets in your bloodstream, and then it makes its way into a liver cell again, and it usually is done. It's going to proliferate and proliferate more. And whenever you have an infestation, like we talked about H. pylori last week, H. pylori is going to cause localized inflammation. Well, where's the inflammation here? In the liver, and that's called liver inflammation or hepatitis, right? So you get hepatitis A, hepatitis B, C. It's just localized inflammation in the liver cells, right? And those liver cells get hijacked by hepatitis B, and they make it stuff, right? They make it like a sweatshop, and they start making more and more hepatitis B. And eventually it gets into that person's blood, and of course some of it will bleed over into their secretions, right? So that's hepatitis B. And hepatitis C, same thing. Is hepatitis C by fecal oral, or is it by blood and secretions? Blood and secretions. And as we'll find out, it's really IV drug users are like the highest risk for this, right? So it gets, IV drug users are using an IV to put it from the environment into their bloodstream, right? And as it gets to the bloodstream, it's going to make its way to the liver. It just has more preference for the liver. So hepatitis C virus, so HCV, is make its way into the liver, cause all kinds of inflammation, and then it replicates and replicates and replicates, and then it could cause an acute illness, or it could cause a chronic illness. And as we'll find out that like hepatitis C, for instance, doesn't usually cause a prominent acute illness. Usually it develops into cirrhosis. Hepatitis B also develops a cirrhosis. We'll point that out. So B and C develop chronic disease, where hepatitis A is A for acute only, right? Hepatitis A does not convert to cirrhosis. Hepatitis A you only get hepatitis from it. But you can get hepatitis from all the viruses. But as far as like rarity, like hepatitis C is probably the most rare to get like an acute illness from it, but it's quite common to get a cirrhosis from it. Okay? So you can develop chronic cirrhosis from a hep C infection. Which other one do you get chronic disease from again? Hepatitis B. So B and C can develop into cirrhosis. So I should probably just put this one here. So B also can lead to cirrhosis. Okay? So, and how long does that take? You think like, well, if I get an infection, maybe it'll take 12 weeks, a month, a year. How long does it take? 50 years, about 20 to 30 years on average, right? Up to 50 years. Then, so all your activities while in college as a teenager or that can catch up with you 30 years later when you're in your 50s, okay? And now you have hep C cirrhosis, all right? And we have diagnostic tests we can do to see that your liver is cirrhotic. You probably get symptoms of cirrhosis, which we'll talk about, and complications of cirrhosis, which we'll talk about, okay? And that liver cirrhosis can then lead to chronic inflammation. It leads to HCC, which is hepatocellular carcinoma, which is otherwise known as liver cancer, right? So you can see these livers is inflamed here. Those cells get inflamed, and because they get inflamed, it doesn't do its functions well, right? There's a lot of functions the liver has, and we'll talk about some more acute functions versus chronic functions, or chronic complications, I say, like cirrhotic complications. But acutely, things can't get through the liver. And one of the things that has to get through the liver is bile. Or I should probably say bilirubin is actually more accurate. Bilirubin, which is made in the bloodstream, has to get through liver, right? Through the liver, and make its way into the biliary tract. And that can't happen, and therefore the bilirubin builds up, and you get what symptom? You get jaundice, right? So that's one thing. That's because the liver's so inflamed, the bilirubin can't get through. Okay, and bilirubin then it gets mixed with bile. So there's a difference in bile and bilirubin. The bile gets its name because it has bilirubin in it, right? And we'll talk more about bile. You're looking forward to that, aren't you? Anyways, we've got hepatitis A and E, right? Right, those are affecting the bowel. So the bowel, so it goes from the colon, right? It could be the small intestine also, but all that stuff makes its way into the liver and inflames the liver, right? And it can produce more into the bloodstream, and we can do blood tests to detect it, right? We could detect hepatitis A virus. We could detect a antibody response to the hepatitis A virus, right? Whenever you have a bacterial infection or a viral infection or an allergen even, like something from the environment, your body's immune system is going to attack it, right? It just doesn't attack it once. It says it's going to prepare for the next time, right? And it forms antibodies against antigens, right? It's kind of a lift off from your blood lecture from 103, right? You form antibodies against things that could harm you, okay? And hepatitis A, hepatitis B, you could form antibodies against, right? So we can detect that, and we'll talk about that. All right, and the other option is hepatitis B, C, and D, right? From where? Where do you primarily get that? From blood cross-contamination, from secretions, right? These things can make their way into the bloodstream, IV drug use, right? Either way, usually IV drug use is venous, but that's going to then make its way into the liver and cause liver inflammation, okay? The reason I bring this up is the portal circulation. The portal circulation is what comes from your GI tract and filters in the liver. Usually the whole purpose of this is to filter out all the bad stuff, like hepatitis or like a toxin, like something in the environment that could harm you. Our liver detoxifies, right? And it's the first stop after anything that comes from the GI tract, right? So that all goes into the portal circulation. So from your stomach, it gets detoxified in the liver. It's actually called the first pass in pharmacology. When you take medications, your liver is going to knock off like a little tax, like a mafioso. It's going to take off like 20%, right? And then it finally then might get into the bloodstream, right? If your liver doesn't work, you're at higher risk of toxicity, right? What else? So that's the overview of this, right? I'll also demonstrate how in the liver, if you like zoom in right here, in the liver and the liver cells, all this toxins or hepatitis, for instance, makes its way into the liver, and it goes up this little venule here from the portal circulation, and it goes through these liver cells. They're called liver sinusoids. They're like little triangle shaped, and they fit into a nice little hexagon shape. Cool. Either way, it goes through this, and then you can see how direct access it has to the bloodstream right there. That's now the inferior vena cava. So you basically have very little room between the GI tract and the vena cava. And also remember, your liver makes bile. It takes bilirubin from the bloodstream. It takes other components like cholesterol and it makes bile salts. And then it's going to go ahead and pop those down the bile tract right here. Okay? So it's going to make bile, and then it gets stored in the gallbladder. So just to see your overview of your anatomy.